namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacy Banfield here with Dr. Stephen Hotze, the founder of the Hotze Health and Wellness Center. And as always, this is the place where you can go to find out more about natural approaches to health, doing a 180 and taking charge of your health. We have all kinds of great podcasts for you to take a look at. All you have to do is go to HotzePodcast.com. That's HOTZE podcast.com. Now, hypothyroidism. We get a lot of calls about this, a lot of questions. Some people have even been diagnosed with hypothyroidism, and they've
by the conventional doctors, which is rare as hen's teeth.
That's right, rare as hen's teeth, absolutely. And so one of the things, though, when people call in, they have various symptoms, but one of them that isn't mentioned very often, but it's a real problem, and people do need to be aware of how severe it is the link between hypothyroidism and their heart. So, Dr. Hotze, maybe you could share with our audience what that means for them, what they need to be on the lookout for.
Thank you so much, Stacy. I'm Dr. Hotze, and I believe you need a health coach. You need a doctor and a staff of professionals to coach you onto a path of health and wellness naturally without pharmaceutical drugs. So as you mature, you feel good. You got energy. You got to get up and go. You got vim and vigor. You got enthusiasm in your life. How many of you feel like that right now? Well, I tell you, I do, and I know that Stacy does too. So, and the reason we do is because we have taken charge of our health. We've done 180s. I did mine decades ago, 25 or 30 years ago. I made that 180 choice when I was introduced to natural approaches to health. And when I did that and saw what a benefit it was to not only myself and my family, but also to my guests, I said, man, this is the way I'm going. I'm going to take care of people naturally without the use of pharmaceutical drugs. I'd been brainwashed for decades, back in med school and in the first part of my career about using pharmaceutical drugs. But you know what? All I did was see my patients get sicker quicker all the time, and they didn't feel well, and they told me they didn't feel well on the drugs, and we're always given one drug to counteract the effects of the previous drug. So when I abandoned that, one of the first things I was introduced to was the problem that the vast majority of Americans, I mean the majority of Americans, I don't mean a small percentage, a vast majority of Americans have with a condition known as hypothyroidism or low thyroid that exists within their cells. You have 70 trillion cells. Every cell has a power plant, at least one. Some cells have thousands of power plants. The power plants produce energy. The energy is electrical energy, which is then disseminated into the cells to energize all the biochemical processes. And this is electrical energy. And then as the cells are healthy and they function properly, then the organs function properly. When the organs function properly, you're healthy. But you have to have good energy production within the cells. The thyroid hormone, which comes from the thyroid gland in your neck, enters the bloodstream. Most of the thyroid in the bloodstream, 80 to 90% of the thyroid in the bloodstream, is the inactive thyroid hormone T4. This is the thyroid molecule. It's got 4 iodine atoms on it. It's T4. It's inactive. It has to enter the cell. Within the cell has an enzyme that cuts off one of the iodine atoms. You're left with 3 iodine atoms on the thyroid molecule. It's called T3. It's the active thyroid hormone. It then goes into the mitochondria and activates the production of energy. In America, we use fluoride in our water. 70% of the population has fluoride in the water. By the way, 70% of the population is overweight. I wonder if there's any correlation with that. 70% of the people drink fluoride. Why? Well, it's supposed to help us from having cavities. Yeah, but it poisons your thyroid gland. It poisons the enzyme within your cells called deiodinase. It cuts off one of the one of the iodine atoms off the thyroid molecule from T4 to T3, so you have active thyroid in your cell. If you don't make the conversion, then you've got T4, which is the prohormone, and it's a very inactive hormone, and it does very poor job activating any energy production within your mitochondria. Okay, so you've got this problem. What does it cause? Well, there's a host of problems, one of which it can lead to coronary artery disease, and let me explain how. It also lead to heart failure. Hypothyroidism causes the cells to produce a glue-like substance called mucin, M-U-C-I-N, mucin, which gets in the cells and makes the cells swell. So you see people with hypothyroidism, they get puffy and swollen faces. They get an enlarged tongue. Stick your tongue out, look in a mirror. If you've got mottling on the borders of your tongue's enlarged. It's growing up against the teeth. It's scalloping. You can see that. Loss of the lateral third of your eyebrows. Dry, scaly skin, puffy skin. It looks edematous, but it's mucin edematous. You know, when you have certain type of edema, you can press on it and you can put a fingerprint in it. You can't do that with this. It's just swollen. All the tissues are swollen. The neck is swollen, and they look puffy and they're pale, and their hair falls out on areas of their body. They lose their hair, and they just don't look well because they got this mucin. Well, that mucin builds up within the coronary arteries, and they swell. And when that happens, and when you get it in the muscles of cells of the heart, it causes the heart to function less than optimally. Remember, if you don't have good energy production, your body's not going to have good metabolism, and it's going to run sluggishly. And this mucin begins to build up. And also, when you have hypothyroidism, you have an increased inflammatory response in your body. Part of the body, when it runs normally, is to reduce the inflammation, but you get inflammation buildup from all the toxins you have in your system that aren't getting cleared out because your body's operating at a sub-normal rate metabolically. It's not functioning well, and so you end up getting the inflammation in the arteries, and you get this buildup of the mucin, and the next thing you know, then the calcium gets assimilated into these plaques in the wall, and the next thing you know, you've got narrowed coronary arteries, and then what? You throw off a plaque, a plug, and a clot hits that artery, and it clogs it up, and you don't get any blood flow to parts of your heart, and you have a myocardial infarction is what the doctors call it, a heart attack. And guess what? Half the people who have their first heart attack die. So it's the old adage, an ounce of prevention is worth a pound of cure. You don't want to have a heart attack and die. You don't want to have a heart attack and then have to have a bunch of heart surgery and stents put on you, and the doctor's going to put you on a pot full of medication. You're going to get sicker quicker and lead a very suboptimal life. What you need to do is you need to listen to your body, to what your symptoms are and what your signs are, and you need to go to a physician like those of us here at Hotze Health and Wellness Center who identify hypothyroidism and diagnosis based upon the clinical symptoms and the sign the patient has. We know this. No matter how much thyroid you have in your blood, you can still be hypothyroid intracellularly. You're not getting enough active thyroid into your cells to enable the mitochondria, the power plants, to produce energy. You follow that? Does it make
Yes,
sense?
and that's where a lot of doctors fall down because they don't diagnose by just looking at the patient, or Dr. Hotze, what you're talking about, the certain attributes of hypothyroidism. They're just like, oh, the blood test says this. Well, you may have plenty, but if it's not getting into your cells, who cares? So that's where it falls down.
This is the tyranny of the blood test. This is what the doctors do. They look at the blood test, and the lab gives them a range of normal. In a thyroid blood test, the lab determines the range of normal by the last 1,000 blood tests that were taken. The lab has an average, and then it takes two standard deviations, which is a statistical term. And when you go two standard deviations on each side of the mean or the average, that encompasses 95% of the population. And they say that's normal. That's the normal range. So you can see the normal range is as high as the Empire State Building, as wide as the Grand Canyon, and you can't hardly fall out of it. You know, if you were up here and had an optimal level of thyroid and felt great when you were younger, and now your thyroid level's gone down, and it governs your body's metabolism, your energy production and usage, and now it's low. If you've lost 50%, the level's gone down 50%, you think you're going to have more or less energy. You're going to have about 50% less energy. You're going to feel sluggish. But you go to the doctor, and he may say, it's all normal. Well, or it's in the low range, but not low enough to treat. Well, my philosophy is this. I believe that if you have the signs and symptoms of hypothyroidism, which would be what? Let's go down the
Okay,
list.
sure.
We're going to go down the list. Loss of energy, fatigue, difficulty losing weight, cold body temperature, low body temperature. Body temperature should be 98.6. If yours runs lower than that, that means you're not producing enough energy in your cells. Brain fog, no mental sharpness. You just can't remember things. You can't remember names. You can't remember what you're doing. You're forgetting how to do things. Poor sleep, joint and muscle aches and pains. Just ache. You don't seem to recover very well if you do a workout. You ache all the time, or maybe you don't work out and you still ache. You can have abnormal bowel function. Unless you've been on a lot of antibiotics in your life and have yeast problems, commonly hypothyroidism leads to sluggish bowels. Frankly, that can be a huge problem. And most people think, well, if I have a bowel movement every 1 or 2 or 3 days, that's just normal for me. That's what my doctor told me. Well, it's not normal. It's not healthy. You're a pipe. You got a digestive pipe. Starts with your mouth and goes all the way to the other end, and probably it's about 30 feet long once you stretch out all the intestines. You got to keep the pipe clean. You got to keep it flushed out. And if you're eating properly and and have a proper level of thyroid and taking proper magnesium, you're going to have several daily constitutions. Anytime you eat, you're going to eliminate. And that's the way it should be. That's the way it is with animals. They eat grass. They go out in the field. After another, they keep themselves clean. You want to keep the pipes clean to be healthy. That's most important in your health, is to have a clean digestive tract. If it backs up because it's filled with a bunch of stool, you're just not going to do well. So you've got to get yourself very regular several times a day, and low thyroid will lead you to being constipated. It's a very common problem. That's what they sit around and talk about at the old folks home. Hey, Ma, did you have your daily constitution today? Yeah? Well, I hadn't. Well, I thought you seemed a little constipated in your attitude. That's what they talk about. It's a big deal. The old folks sit around and talk to each other about that. Well, that shouldn't be a problem with you if you are on if you have adequate thyroid within your cells. And if you don't, you're going to have a problem. Now, it can also lead to recurrent and chronic infections. If you tend to have allergies and are prone to infections, guess what? You'll get recurrent infections because your immune system doesn't have enough energy to fight off the infections. Women can have irregular menstrual cycles. They can have infertility. They can have problems with miscarriages, all commonly caused by a low thyroid condition within your cells.
And did you mention depressed moods?
Oh, the moods can also be, you can have depressed moods with it, or mood swings. It can cause a host of problems. It also leads to an increased risk of cancer. And guess what the most common cause of cancer? One of the most common causes of cancer in America is that we see it at a much higher rate than we see in other countries, and that's colon cancer, because the bowels are sluggish. You keep all that stuff in you, it's going to make you sick. Your bowels are going to get sick. Your bowels are sick, then you can't properly assimilate the nutrients that you need, and some bad nutrients or some bad substance is going to pass into your blood system and cause you health problems. So you want to make sure you have a healthy intestinal tract, and a good way to do that is with, of course, with thyroid. Now, the other thing, because of recurrent and chronic infections in a poor intestinal tract, this also adversely affects your heart. Not only do you get the buildup of the mucin in the heart cells and in the artery cells in the heart, the coronary arteries, and you get the inflammation, you get the buildup of the cholesterol, but also, the buildup of the calcium in these plaques. There's also bacterial and viral infections that can affect you. And if your immune system is unhealthy because you don't have enough energy, then you can get bacterial infections that can settle in the coronary arteries. There's certain bacteria, when they look in the coronary arteries, they find particles of bacteria like Helicobacter pylori that's in the stomach. And other bacteria, particles are found there. So when you get sick and you have a poor immune system, guess what? That bacteria floats around and it'll gravitate towards areas of inflammation in your body, which would be in your coronary arteries. So those are the signs and symptoms of hypothyroidism.
Well, and Dr. Hotze, just really quickly, this leads to another problem too, because all of those symptoms of hypothyroidism are so very different, and that leads to a huge problem with the doctors who try and prescribe based on symptoms. So they never figure out it's hypothyroidism. They just try and attack each symptom with a what? A pharmaceutical drug. Absolutely.
Which, by the way, is a toxin. Every pharmaceutical drug is a toxin. By definition, that means it's a poison. You got to detoxify it. You don't detoxify anything but toxins. So in the definition of toxin is a poison. So when you go to the doctor and he goes, well, everything's fine in your blood, I think we're just going to give you a little anti-inflammatory for your joints. We're going to give you some sleep medication. We're going to give you something for your depression, a little antidepressant. We'll give you something for your panic attacks and anxiety. We're going to give you something for that irritable bowel syndrome you have. We're going to give you something for blood pressure. We're going to give you something for your diabetes. And we're going to help you feel really good. And so the next thing you know, you're on a pot full of pharmaceutical drugs, which are toxic. And if that isn't just crazy, I don't know what is. It violates every principle you have about common sense. Why would you put a toxin or a poison in your body and think you can poison yourself to good health? How does that make any sense? It doesn't make sense to me. And the results prove it. You look at the people, they're unhealthy. We see them all day long here at the Hotze Health and Wellness Center. They come in, they got their bags of drugs or a list of all the drugs they're on and how bad they feel. Here's what happens. People get sick as they age. They don't eat right. We've talked about it in another program, ketogenic eating program. I recommend you go listen to that podcast or watch it on YouTube. They don't eat right. Their hormone levels decline. And so that adversely affects their cells' ability to produce energy. They don't have enough vitamins and minerals and nutrients because they're eating packaged, bagged, and canned food, fast food. They're eating burgers from Burger King, or they're eating hamburgers or French fries from McDonald's, or they're eating pizza at the pizza parlor. And then they're drinking and guzzling Coca-Colas and you name it, all the sugary drinks. And it's one thing after another. They're poisoning their bodies with their food. And they're not getting any vitamins and minerals and nutrients, which you have to detoxify your cells. And they're not exercising because they don't have any energy. And they don't lose any weight when they do, which, by the way, you exercise to tone up. You don't primarily exercise to lose weight. You eat healthy to lose weight. To lose 1 pound of real fat, you've got to run approximately 35 miles. A pound of fat's 3,500 calories. Every mile you run, you burn off 120 calories. Just divide 120 into 3,500 and you'll find out it's 30 to 35 hours you got to run to lose a pound of fat, when you can easily lose fat by going on a healthy ketogenic lifestyle eating program. So those are the 4 things that are important, but I want you to remember that to keep your metabolism up, supplementation with natural desiccated thyroid, not with synthetic thyroid. Our experience is we see literally thousands of people have come through our center that say, I've been taking this Synthroid. So they got diagnosed with low thyroid. Their blood was, so only 5% of are really on the one end of the range. 2.5% of the people are ever going to get the diagnosis with their blood test. And they've been put on synthetic thyroids, and they look hypothyroid, and they have all the symptoms of hypothyroid. But the doctor says, well, your blood's now normal, so it couldn't be your thyroid. Well, of course it is. The synthetic thyroid isn't even the active thyroid. It's T4. The body has to convert it to T3 in the cells, and if you got a lot of fluoride in your system and your enzymes are poisoned, you can't make the conversion. So they can change the blood, but they don't make you healthy. So if you're taking a thyroid preparation and you're not experiencing any improvement, and then you're on a synthetic thyroid, it doesn't work. It just doesn't. So I want to encourage you to consider, and I guess I can go to our symptom checker.
Yes, absolutely. If you think you have signs and symptoms of hypothyroidism, we have a great tool online for you. It's our symptom checker. All you have to do is go to hotzehwc.com. That's HOTZE, HWC.com, and take the test. Very simple. And you can also have a conversation with one of our wellness consultants at 281-698-8698. That's 281-698-8698. We'd love to be able to serve you, give you more information you need about doing a 180 and taking charge of your health. Dr. Hotze, thank you so much today. This is such an important topic. It's a commonly misunderstood topic, so I'm glad we could cover that today. And thank you, everyone, for joining us today at Dr. Hotze's Wellness Revolution.
And I want to remind you to go to our podcast and subscribe to it. And go to our YouTube and subscribe to it at Hotze Health.
Yes,
Hotze Podcast.
that's right. Very easy to find our podcast.
So if you're watching or are listening to us now, just subscribe to it and we'll send you out our weekly podcast.
And those of you who have subscribed already, we appreciate the support.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.